In today's population of over 318 million people, many individuals are living and functioning with serious health problems. This feat is possible due to the doctors and healthcare services that save lives every day. The 2013 census recorded that 46.5 million Americans were living in poverty, making it challenging to have access to healthcare. Medicaid was instituted in 1965 by President Johnson so that low-income families could afford medical treatment. Between 1965 and 2014, most Americans of low income depended on Medicaid. As of 2012, the Affordable Care Act is an expansion of Medicaid. The ACA makes a larger percentage of people eligible for Medicaid under the ACA. This seems like a policy that will help the people, but what if Medicaid was phased out completely and there was only the Affordable Care Act? People who have low incomes tend to be less healthy because of the environments they live in. For instance, low-income people don't usually live near hospitals and primary care doctors. Poverty prevents people from buying healthy foods. This is one of the biggest contributors to poor health in low-income communities. Due to stress, poor people are more likely to smoke, and on top of the secondhand smoke in the air quality itself is poor. The larger portion of frequent hospital patients are Medicaid users. There is a higher number of patients on Medicaid for two reasons. One reason is that the Medicaid users tend to be the at-risk patients, meaning they're more likely to have complications after surgery or medical procedures than others. Another reason is the lack of out-of-pocket money spent. The data showed that people with Medicaid visited the emergency room more frequently than people who are privately insured. They also went to the emergency room, but it could have been a visit with their primary care doctor instead. From what you've heard so far, you've probably come to the conclusion that Medicaid users overuse their resource and is unfair to those who aren't on Medicaid. Well, that is partially true. The ACA plans to change that by charging everyone, and not a co-payment but a minimum fee that all patients have to pay. This isn't unfair, but it contradicts the whole purpose of having Medicaid. It's like the ACA has created a loophole. Before the expansion of Medicaid, a person had to be in a certain range to receive Medicaid. Basically, you had to be poor, but not too poor, because if you had no income, you weren't eligible. Money is always an issue, especially when it comes to health. Hospitals were losing funding because of the abundant amount of people on Medicaid. The humanitarian view of things was to make sure that the people are properly cared for, or at least have the access to proper care. But cutting funds due to Medicaid expansion is making the situation worse. More people have access to medical treatment, but there aren't enough hospital beds due to the funding cuts. In 2012, the Supreme Court ruled that states may opt out of Medicaid expansion, and as of November 2013, 25 states have done so. States that are opting out don't have their residents' health at top priority. Predictors showed that all low-income adults will face a greater likelihood of depression, catastrophic medical expenses, and death that live in the states that have opted out of ACA. All of these things will be the effects of untreated medical conditions. So what will happen now that nearly everyone is eligible for ACA? Luckily for hospitals, it's optional for states to expand Medicaid. Now that we know